Cancer treatments leave a trail, and if you are new to working with oncology clients, it's probably the short-term side effects you spend time thinking about. These are the side effects that present during treatment, then improve when treatment ends. Fatigue, compromised immunity, easy bruising and bleeding. Skin, hair, and nail changes. Flu-like symptoms, bone and joint pain, nausea. Mouth sores, dry mouth, and changes in taste. And gastrointestinal disorders that include bloating, abdominal pain, constipation, diarrhea, and vomiting. Edema caused by inactivity, medications, or the disease process, and blood clots for the same reasons. Many of the short-term side effects can linger longer though, resolving slowly if ever, and are then called long-term side effects. To add to this already long list are lymphedema, or risk thereof, early menopause and the related symptoms, peripheral neuropathy, and the cognitive challenges that are also called brain fog or chemobrain that affect memory and the ability to learn new information. And then there are the late effects of treatment. These are the side effects that were given little or no thought during the treatment phase, and can be a complete surprise when they crop up many years or even decades later. Cancer cells are considered fast-growing cells, and so many of the cancer drug treatments are designed to target and destroy fast-growing cells. What many cancer drugs cannot do, though, is properly differentiate between fast-growing cells that are cancer cells and fast-growing cells that are healthy cells. And that is one of the reasons why there are so many side effects associated with cancer treatment. Blood cells, skin cells, and the cells that line the gastrointestinal tract from oral cavity through to anus are considered fast-growing cells and are very affected by many of the cancer treatments. Although often thought of as short-term side effects, fatigue, compromised immunity, and easy bruising and bleeding can last for a long time after treatment, sometimes years, and in many cases become long-term side effects. All three are directly related to blood cell count levels, a very important clinical consideration that therapists need to be knowledgeable about. Altered blood cell counts are caused by many of the cancer drug treatments, and in some cases by radiation and also the disease process itself. There are three types of blood cells: red, white, and platelets, each fulfilling a unique role in the body. Blood cell counts are at their lowest 7 to 14 days after drug treatment. This is called the nadir period. While in treatment, blood cell counts can change significantly day to day, and when working with clients in active treatment or in recent recovery, it would be considered best practice for the therapist to assume that a low blood cell count is present and modify accordingly. Red blood cells are dedicated oxygen carriers, and when in short supply, body tissues do not get enough oxygen to do their work. Symptoms of a low red blood cell count can include fatigue, shortness of breath, feeling faint, dizziness, weakness, or lightheadedness. White blood cells are a part of the immune system and help protect the body from infection, disease, and foreign invaders. Different types of white blood cells are involved in recognizing intruders, killing harmful bacteria, and creating antibodies to protect against exposure to some bacteria and viruses. A low white blood cell count is referenced as neutropenia or leukopenia. In medical terminology, there is a lot to be learned from how words are constructed. Penia is a suffix originating from Greek, the first language of medicine, and means deficiency, or not enough, of whatever the front part of the word is referencing. Neutrophils and leukocytes are specialized white blood cells, so neutropenia means not enough neutrophils, and leukopenia means not enough leukocytes. Patients with a low white count have compromised immune systems and are very susceptible to anything contagious. and extremely vulnerable to bacterial and viral infections. If a patient with a low white blood cell count develops an infection, it could result in a life-threatening situation, and they may need to go into hospital for intravenous antibiotics. Thrombocytopenia refers to a low platelet count. Platelets are the blood cells that help to stop bleeding by forming platelet plugs to repair damaged blood vessels. For patients with a low platelet count, clotting occurs slowly. Bruising and bleeding occur easily, and bleeding once started can be difficult to stop. These are the patients whose gums may bleed when they brush their teeth, easily develop nosebleeds, or get pinprick bleeding and bruises on their skin called petechia or purpura. During cancer treatment, patients will regularly have their blood cell count levels checked, and if their counts drop too low, booster drugs or infusions may be used. Or their cancer drug treatment dosage may be reduced or stopped until their counts recover to acceptable levels and their body is strong enough to continue with treatment. Fatigue, compromised immunity, and easy bruising and bleeding all have low blood cell counts as underlying cause, and are serious side effects of treatment and effects of disease that therapists need to know how to modify for. One of the many challenges that the person with a cancer history faces is that following completion of their treatment, family and friends oftentimes just want life to get back to normal and to leave the cancer experience behind. But that is when the real challenge of the new normal starts. Learning to live with uncertainty, concerns about reoccurrence, ongoing health problems caused by cancer treatment, and the stress of trying to remain positive for family and friends all take their toll on mind and spirit. As do the many tests and procedures that will still need to be done on a regular basis. What is frequently considered the end of cancer treatment for family and friends is only the next step of the cancer journey for the survivor. And surprising as it may seem, many cancer survivors will say that remission was the hardest, and when they felt the most vulnerable. Even once patients receive the NED, or all clear, news from their clinical care team, the looming shadow of all clear for now is always present. Life after a cancer diagnosis is different, and adjusting to the new normal often not easy.